There is clear evidence in the presence of estradiol receptors in the female lower urinary and genital tract. So the lower third of your vagina is full of receptors for estrogen and CBD, but that article doesn't talk about that. And an estrogen deficiency after menopause may cause atrophy in your pelvic floor. This is 100% true. So because you have this estrogen change, you have an increased risk of urinary incontinence, as well as pelvic organ prolapse, which they call POP, incontinence of other sorts, and vulvovaginal symptoms, basically like a lichen sclerosis. What they're saying is the tissues of the vagina desperately need estrogen because estrogen is a water-loving molecule, and when you lose that estrogen, the tissues don't remain plump. And putting some hormones internally on the lower third of your vagina where there's a ton of estrogen receptors can help your pelvic floor be plump and strong, can you help your urethra stay sealed and closed. It helps your skin. I cannot tell you enough, if any of these sound like you and you have been trying physical therapy, you have changed your fiber, you have changed your hydration, and nothing is changing, you might need to talk to somebody. So the majority of studies found that when people were given vaginal estrogen therapy compared to placebo, they did have more benefits, and they had improved, they had decreased vaginal atrophy. So that means like their muscle bulk and like their tissues became hydrated. They had less burning because if those tissues become dry, then there is burning. Dyspareunia. So like basically you can have burning with urination, you can have burning with intercourse, you could have just burning to have burning. This is a real thing for women as their hormones change. You know, I think people talk about the dryness that comes with intercourse, but people don't really want to talk about all these things that I see as a women's health physical therapist. And this is one of the reasons that I am a firm believer in hormones. So topical hormones vaginally changes people's lives. And if you are a woman that this speaks to you, go back to your doctor and have a conversation. We know that with Medicare, they are no longer doing pelvic exams on you. And so you could have gone to your gynecologist and told them this, and they maybe never saw your vagina. Yes, I am thankful that they sent you to therapy, but you need to show them.